Hello and welcome everyone. Today we'll be talking about comparative picture of viral hepatitis. हमने देखा है कि viral hepatitis जो है वो 5 तरह का होता है and how can we differentiate between each one of them? That will be covered in today's topic. So in this topic we'll be talking about comparison of hepatitis A, B, C, D and E on the basis of causative agent, mode of transmission, incubation period, diagnostic tools, treatment, as well as vaccine. So this is the comparison on the basis of causative agent. As the name is saying, hepatitis A is caused by hepatitis A virus, also known as HAV. Hepatitis B is caused by hepatitis B virus, known as HBV. Hepatitis C is caused by hepatitis C virus, known as SCV. And hepatitis D is caused by hepatitis D virus, known as HDV. And at the last, hepatitis E is caused by hepatitis E virus, commonly known as HEV. So you can see all these viruses, the name is taken depending on the type of virus which is causing the disease. The next difference is on the basis of mode of transmission की जो disease है वो किस तरह से फैलता है. What is the transmission route for the same? So you can see here hepatitis A and E, they are transmitted through the fecal-oral route, and hepatitis B, C and D are transmitted through blood and body fluids. What you have to remember is that always hepatitis D will happen if there is the presence of hepatitis B. इसका मतलब ये है कि किसी भी पेशेंट को hepatitis D तभी हो सकता है जब उसे hepatitis B भी हो. Why? Because hepatitis D virus is a defective virus. It needs hepatitis B for its replication and its multiplication. The next point of difference is on the basis of incubation period. Incubation period for hepatitis A virus or hepatitis A disease is 15 days to 45 days. For hepatitis B, it is 1 month to 6 months, or we can say 30 days to 180 days. For hepatitis C, it is usually 2 weeks to 6 months, or we can say 14 days to 180 days. When we talk about hepatitis D, it is same as of hepatitis B. The incubation period is same, that is 1 month to 6 months, 30 days to 180 days. For hepatitis E, it is 14 days to 70 days. So this is the difference on the basis of incubation period for different viral infections. Next difference is on the basis of diagnostic tool कि हम इनको diagnose कैसे करते हैं. Hepatitis A को diagnose करने के लिए हम टेस्ट करवाते हैं anti-HAV IgM, anti-HAV IgG and HAV RNA. ठीक है, हेपेटाइटिस A वायरस HAV उसके अगेंस्ट हम क्या देखेंगे, anti-IgM antibodies and anti-IgG, anti-HAV IgG antibodies and anti-HAV IgM antibodies. उसके साथ में हम तीसरा टेस्ट क्या करेंगे क्वांटिफिकेशन करने के लिए, व्हाट इज द लोड ऑफ द वायरस, HAV RNA टेस्ट. रिमेंबर आपके पास जितने भी ये 5 वायरस हैं, apart just hepatitis B is a DNA virus, otherwise hepatitis A, C, D and E, they are the RNA virus. तो आप क्या चेक करोगे, HAV RNA चेक करोगे. For the diagnosis of hepatitis B, we perform different testing, like we can test the HBs antigen, HBe antigen, HBc antigen. इसमें क्या है ये, surface antigen and whelp antigen and core antigen. Then you have anti-HBs antibodies, anti-HBe antibodies, anti-HBc antibodies, IgM, IgG antibodies, and then your viral count, viral load, that is your HBV DNA load you will be checking. The third one is hepatitis C. इसको assess करने के लिए, इसको diagnose करने के लिए we go for anti-SCV testing and SCV RNA testing. For the assessment of hepatitis D, we go for anti-HDV testing and HDV RNA testing. And for the diagnosis of hepatitis E, we go for anti-HEV IgM, anti-HEV IgG, they are the antibodies. Then your HEV antigen and HEV RNA, that is your viral load. So these are the diagnostic tools with which we can diagnose hepatitis A, B, C, D, and E respectively. Next difference is on the basis of treatment. How can we treat? Whether the treatment is required or not required. So basically for the treatment of hepatitis A and E, we do not use any specific therapy. We give the supportive therapy only. So the treatment or the management of hepatitis A and E is usually supportive. When we talk about hepatitis B, C, and D, hepatitis B is treated with the help of antiviral drugs. Usually, when a person is having chronic hepatitis B, then only he'll be needing the therapy. Otherwise, the supportive management is used for the management of a patient with acute hepatitis B infection. Chronic hepatitis B में हम क्या use करेंगे? It is a viral disease. We'll be using the antiviral medication for the management. When we talk about hepatitis C, we treat it with the help of direct acting antivirals, also known as DAA, directly acting antiviral medications. And for hepatitis D, usually we treat hepatitis B for the management of D also because they comes concomitantly with each other. But yes, you may use interferons and the therapy like that for the management of hepatitis D also. The next difference is on the basis of vaccine. Okay, vaccine available है कि vaccine available नहीं है. So for hepatitis A, yes, we have the vaccine available. It is available in 2 doses, 6 to 12 months apart. When we talk about hepatitis B, yes, the vaccine is available. It is available in 3 doses, which is given at 0, 1 month, and 6 months. And when we talk about hepatitis C and D, हमारे पास वैक्सीन अभी तक अवेलेबल नहीं है दोनों के लिए. Hepatitis E के लिए the vaccine is available in 3 doses at 0, 1, and 6 months. But in India, we do not have the vaccine for hepatitis E available. So basically, India में hepatitis A के लिए vaccine available है, hepatitis B के लिए vaccine available है. It is not available for hepatitis C and D and E in India. And hepatitis C और D की वैक्सीन अभी है ही नहीं अवेलेबल कहीं पे भी. So in a nutshell, this was what we talked about. We talked about कि hepatitis A, B, C, D और E में क्या difference है on the basis of causative agent, mode of transmission, incubation period, diagnostic tools, treatment, and vaccine. So before I stop this class, I'll give you questions which you have to write down in the comment box. That is, hepatitis B is a DNA virus or is it a RNA virus? The next question is, out of the following, which hepatitis virus does not transmit through the parenteral route or from the blood and body fluids? A option is hepatitis A virus, B is hepatitis B virus, hepatitis C virus, or D is hepatitis D virus. So whatever your answers are, you have to write down in the comment box. In the next class, we'll be talking about the answers for the same with the rationale. Until, thank you so much.